The CDC has confirmed 2 new malaria cases in Florida. This year, a total of 6 cases have been discovered in Florida and 1 in Texas. They're the first locally transmitted cases in the U.S. in 20 years. Officials also say at least 2 mosquitoes in Michigan have tested positive for EEE. That virus has a 33% mortality rate. CBS News correspondent Omar Villafranca reports.
Mosquito spraying trucks in Florida are ready to fight the bite after 2 more cases of malaria were reported in Sarasota County. The new cases bring the total to 6 in Florida and 1 in South Texas so far this year. Pest control companies like Mosquito Shield are staying busy this summer in Texas, battling the bugs with sprays and killing larvae with granules.
They're definitely bad everywhere, but the mosquitoes with the humidity and the high temperatures, they're definitely out and about. They carry a lot of diseases like the Zika virus, malaria, encephalitis, and it doesn't only affect humans, it affects animals.
Blair DeFore has his property sprayed every year to protect his family.
When the grandkids come over too, it's nice to know I'm providing a safe environment.
The CDC issued an alert to doctors to keep an eye out for new cases. Testing for malaria is not common, but the CDC says medical professionals can easily identify the illness if they do a blood test. And be aware of symptoms like headache, fever, and muscle aches. More severe symptoms can include mental health changes or lung and kidney failure. Doctors urge people to take the disease seriously.
Severe malaria can be deadly, and it is a medical emergency, so people who have signs and symptoms of malaria should get checked out as quickly as possible.
To prevent bites, the CDC suggests using a mosquito repellent, something with DEET. You can also spray it on your clothes. And speaking of clothes, if you can, they suggest wearing long-sleeve shirts and pants to avoid getting bit. Also, if there's any standing water where you're going to be, empty that, because even just a teaspoon is enough for mosquitoes to breed. And avoid going outside at dusk and dawn, because that is when mosquitoes are the most active. Nicole?
Omar Villafranca, thank you. Joining us now is Dr. Rajiv Chowdhury. He's the chair of the Department of Global Health and a professor at Florida International University. The last time that we saw transmission like this was about 20 years ago. So why is this happening now?
I think there could be a number of reasons for that. One potential cause could be the changes in the environment or the climate change, how that is impacting our ambient surface temperature. And we know that when that happens, the mosquitoes which are responsible for carrying this parasite, they tend to migrate in new areas where they have this more appropriate temperature. They also live longer, they grow and develop faster in those kinds of environments. Also, climate change has an impact on the malarial drugs and the insecticides resistance as well. And that means that our main malaria tools, if you like, might be a bit less effective due to climate change. We have extreme weather events, which means that people also would be moving on to, because of the displacement, into new areas, creating more pressure on the health systems. So there could be a reason related to the climate change, although in this instance, we could not pinpoint a correlation between the new cases with the climate change, but that could be a potential cause. The other important bit that we need to perhaps consider is the fact that people are still traveling in the post-COVID world, if you like, in areas where this malaria is a bit more common or endemic. And about 2/3 of these outgoing travelers are not taking the prophylactic medications and potentially coming back with a malarial parasite in their bloodstream, which could then be, that could expose the local mosquitoes to that parasite. So there could be a number of reasons for it, but again, we need more work to substantiate this situation.
Now, some people worry that bug spray with the chemical DEET is dangerous, and so they opt for more environmentally friendly sprays. What's the safest way for people to protect themselves?
So DEET spray has, since it was first developed back in 1940s, actually after the Second World War, to protect soldiers from, mosquito-borne diseases, has been there as kind of a gold standard to fight off, ward off the bugs or the mosquitoes. And so far, Environmental Protection Agency, CDC, American Pediatric Association has given a green light to the DEET as a kind of a gold standard of the bug sprays, and it only can give you momentary or temporary skin irritations. But apart from that, they have been deemed as generally safe, as long as we adhere to the right guidelines to use it. I would not be too worried if we are maintaining the proper usage guidelines given to the members of the public. In terms of other alternatives, you could have other lemon-based or eucalyptus-based natural bug sprays as well, but then they're kind of low duty when it comes to mosquito prevention. So the gold standard still is DEET, and the benefits massively outweigh any risks.
Health officials are also looking to the fall and want to prevent a so-called triple-demic of respiratory viruses from surging. They're encouraging vaccines for flu, COVID, and if you're older, RSV. As you probably know, this was a big issue last year. So what are the chances this could occur again?
So thank you for that question. The triple epidemic has been a concern since last November, when we saw the rise or the simultaneous rise of respiratory syncytial virus infection, principally among kids, and the flu alongside COVID-19. Now, the possibilities is difficult to judge, but we could say that because of the COVID-19 precautions that we have been taking for so long, many people have not been perhaps sufficiently exposed to new strains of the flu. So there is a possibility of all of the three to co-occur, putting more pressure on the health services. So we need to obviously look into the vaccinations. So the CDC has recommended having the flu jabs updated for everyone aging 6 years and above. Topping up the COVID-19 boosters is always going to be an important step. In terms of respiratory syncytial virus vaccine, there has been a new vaccine which has been given a go by the FDA for mainly pediatric population. For people who age 60 and above. So having those vaccines updated would be an important step towards tackling this triple epidemic that we saw last year, really putting our health services in pressure.
All right, Dr. Rajiv Chowdhury, thank you so much for joining us.
It's a pleasure. Thank you.